If you look at the numbers behind incontinence in women, it's hard to believe just how big an issue it is. Incontinence affects more women than diabetes, breast cancer, and heart disease, but it doesn't get nearly the attention it deserves. That's why the National Association for Continence has created the We Count campaign to help you realize that this isn't just a you problem, it's an us problem. There are treatments available right now that can make a real difference in your life, and we invite you to take action today. Visit nafc.org/we-count for essential facts, insights, and resources on stress and urge incontinence, overactive bladder, menopause-related leakage, and more. That's nafc.org/we-count to learn more and discover that there truly is strength in numbers.
Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org.
Welcome back to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and joining us as always is Sarah Jenkins, the Executive Director for the National Association for Continence. Welcome, Sarah.
Hi, Bruce. Great to be here.
Excellent. Joining us today is another member of the National Association for Continence. It's Holly Cupetis. Holly, how are you doing?
I am great. Thanks, Bruce.
Yeah, for those who are not familiar with Holly, she's the marketing director, and she and Sarah have both been involved with the organization for, it's got to be about 10 years now, isn't it?
Yeah, over 10 years.
And in that time, you guys have come to really understand an enormous amount about, not just incontinence conditions in general, but also what it takes to reach people and to really communicate to people in a way that generates action and motivates results. I think that's a fair thing to say, wouldn't you?
Absolutely. Yeah, we're all about pushing people towards having that important discussion with their doctor.
Excellent. And to that end, that's what we're going to be talking about today, because the NAFC is really about to be starting a campaign that's built around the idea of educating women about what treatments are available and really getting them to take action, to learn about the treatments and to go and seek out professional help from healthcare providers. Is that right?
That's correct. Yes. So we are starting a new campaign starting in March. It's called We Count. The whole goal is to increase awareness about incontinence among women. Over 80 million US women are affected by incontinence. So it's a really prevalent issue that isn't talked about very much. So we really want to raise light around that issue and get people talking about it, show people that this affects a lot of women and that there are treatments available. They just have to talk to their doctor.
I love the name, the We Count name. It sounds like there's sort of a play on words going on there also. I mean, what's the whole genesis of that?
Yeah, so we've seen through research that women are really disproportionately impacted by incontinence due to different things like pregnancy, childbirth, menopause, and as we age, the prevalence also increases. It affects about 75% of women over the age of 65. But as much as it affects women, it's really underdiagnosed and is really rarely discussed. So we wanted to find a way to highlight those stats around incontinence to show women just how common it is, the many different ways that it can affect a person's life, and educate them on the different treatments that exist. So We Count not only highlights these facts, but it also really is kind of a double meaning. It serves as a reminder that we as women count and the condition really deserves to be treated. Women often put themselves last when it comes to taking care of themselves, especially with incontinence. It's something that they generally will brush off as not a big deal, or they think it's normal or just a little bit of leaking, I can deal with it. But really, there are so many treatments that are available to manage the leaks. There's no reason to deal with this condition on an ongoing basis.
Yeah, and that's something that I think that both you and Holly, you bring a perspective as women and as a woman-led organization. You're both parents of younger children, and so you have sort of a personal perspective on this that certainly somebody like me would never be able to bring to the issue because you really are focused on specifically women's concerns with this campaign. Is that right?
Yes. And just to add to that, Bruce, as you said, I've been working at NAFC for a while now, and we talk about this stuff, but yet it feels like no one else is. And it's sort of this taboo secret thing because our moms didn't talk to us about it and our doctors aren't talking to us about it, but yet we're all affected by it.
Yes. When you said that we're all affected by it, what are some of the numbers behind this? When we talk about the statistics, just how common is it?
It's very common, especially in women. It affects almost 80 million women in the US. In fact, 1 in 2 women have incontinence. So you probably know someone who has it if you don't have it.
That's an
And
insane number. Every other woman that you meet has or will have incontinence issues. That's it's like mind-boggling.
yeah, it's really insane. And the fact that we don't hear anything about it is even crazier.
Yeah, and to
And
add to that, I think it's a surprising statistic to learn that incontinence is more common than diabetes and heart disease combined. But yet, as Sarah said, we just don't get the attention, or it doesn't get the attention that it deserves. So I think this campaign to really bring awareness to this is really critical for women.
I wonder if part of that is because I think people take incontinence as if it's sort of a personal failing. It's somehow a mark on themselves in a way that other conditions aren't. Is that your experience that you see people to feel that way?
I think so. Yeah, I think it feels like something that they think they should be able to control. Sometimes incontinence is associated with a condition that a child might have. So there's a little bit of that element that if you're an adult, this is something that you feel you should be able to control. But the reality is a lot of people can't, and it is really widespread in many, many women across the US. And there's a lot of misconceptions. A lot of people think that it happens only to older adults, but the reality is it can happen to anyone. And half of the people who have incontinence are actually under 50. So it's really a widespread condition that affects a wide range of ages.
So, what are you going to be doing with this campaign? What are the particular elements that the target audience might be seeing?
Our goal is to shed light on the stats around incontinence. So each month, we're going to be sharing facts about a specific aspect of incontinence that may be about incontinence and how it affects mental health, or the prevalence of incontinence, or a specific type of incontinence, even stats about incontinence during different life stages, such as pregnancy or menopause. And our goal is really to highlight these facts to help encourage women to have a discussion with their doctor. Most women wait about 6.5 years between the time they first start noticing symptoms before talking to a doctor. And we want to shorten that gap. We don't want women to live with these leaks. There are things that they can do to treat their condition.
I want to ask you about that 6.5 years because, first of all, that just sounds terrible. That you have a condition and you're living with it for years and years before you seek help for it. Is that because symptoms get worse and worse and it just sort of reaches a point where you can't take it anymore no matter what? Or is that because it's just so embarrassing for so many people that they just will refuse to discuss it? Or is it some combination of the two?
Yeah, I think it's a combination of the two. There's definitely a big stigma around incontinence. Women are embarrassed about having this condition. We've done surveys with our own audience, and we see that there's a really deep shame associated with incontinence. No one wants to admit that they have a leaky bladder. And the fact is that as bladder leaks worsen, women tend to shrink their life to fit around that. They avoid social situations, they limit time with friends and family, their work may suffer, they may stop working out. So, their physical health may be impacted, and they're constantly worried about having an accident in public. The stigma around incontinence is really real. So I think that prevents people from talking about it. And then you're right, as time goes on, leaks only get worse. There typically will come a point where the patient just can't take it anymore. They need help from their doctor.
And it sounds like from what you're saying is that the emotional side of things is just as bad, if not worse.
Yeah, a lot of people suffer from shame, embarrassment. Depression has been associated with incontinence. So, all of these different quality of life issues are affected, and it can really affect a patient's mental state.
Yeah, I just wanted to add to that piece of it. I think that often what happens is, as Sarah said, it gets worse over time. But as many women do, you don't prioritize this issue and you sort of keep chugging along, but it gets worse. And before you know it, you are, or women, many women are changing the way they go about their day. They're bringing extra clothes, or they're not staying too long at events, or they're not traveling far distances. And this is what's heartbreaking, but yet what is most critical for us in this mission is to really try to help encourage women to talk to their doctor, that it doesn't have to be that way, to not let it go so long to where, there's suffering, as we say, in silence.
I really do love that this is a woman focused effort, because even though we do talk to women and about women and for women a lot with the National Association for Continence's other materials, I think that this time you're going to be doing things with a little bit more of a focus on women's empowerment. Does that sound right?
Absolutely. Yeah, we really want women to know that this is a very common condition and that doctors are used to talking about it and treating it. It can be scary to bring up, but they really need to just be rest assured that their doctor has heard the discussion before. You need to let your doctor know that you're leaking and that it's impacting your life. And if you have a good doctor, they'll listen to your concerns and help you find a treatment that works for you. And if your doctor brushes you off, it's probably time to find a new doctor. That unfortunately does happen sometimes, but don't let that discourage you. Seek out someone who's going to be willing to help you, because there are a lot of doctors out there that take this very seriously and will address your concerns.
Yeah, that's funny, because that's another stumbling block. If somebody finds that they need to look for a different healthcare provider, that's just another obstacle in the path. And that's another conversation that people may not be all that willing or comfortable to have as well. But that's because, I think, tell me if I'm crazy here, a lot of people don't realize that the results that they can achieve with the treatments that are out there today are remarkable and far better than they've ever imagined, and certainly far better than they've been even 10 or 15 years ago.
Yeah, there are so many treatments available these days, and it can really range from something as simple as diet and exercise to medication. Some patients have even been treated with Botox. There's sacral nerve stimulation, which is a more minimally invasive procedure. And then, of course, surgery can also be an option if you have a very severe case of incontinence where other treatments haven't worked. So it's really important that even if you try a treatment and it doesn't work, to not give up, because there's other treatments out there and you may just not have found the one that's right for you yet.
Yeah, this really is sort of like, the knee bones connected to the shin bone type thing, where what, if you try something that's muscular, and a muscular focused therapy doesn't work, there's nerve therapy, there's medication, it's just so many different ways that this issue can be approached, and there's a really good chance that there's something out there that's just right for you.
Absolutely.
So tell me if this is incorrect, but the goal is sort of twofold. It's not just to get women to go out and speak with their physicians and to feel confident that they can actually have this conversation, but to get the word out as far and wide as possible, to reach as many women as we can, to get them to take these social posts that we're putting out there and other messages, and to share them as well. Is that fair to say?
Absolutely. Yeah, we want to really get this conversation going in the same way that menopause, as more people have started talking about menopause recently, and that's great because for a long time nobody was talking about it. And women, in the same way they suffer with incontinence, which by the way can also be a symptom of menopause, they were suffering for a long time with menopause symptoms and not sharing it with anybody or talking about it. And now it's great to see so many more people are outspoken about that condition and really trying to push the needle in terms of urging women to seek help. So we want to do the same with incontinence. We think it's a condition that deserves to be talked about. It's not something that should just be left untreated or brushed under the rug. If it's impacting you and your life in any way, there are treatments out there that can help. So we want to raise awareness and we want to push women towards those treatments.
Now, Holly, as the marketing director, I think that one of the things that you're going to be leading the charge in is getting the message out and all of the different ways that people can learn about the We Count campaign. So what are some of the different ways that people are going to be able to see elements and learn more about the whole effort?
Yeah, as I think you mentioned, Bruce, we are going to have a social media campaign where every month we're going to be sharing key statistics in infographic visuals on our social media channels. So Facebook, Instagram, LinkedIn, and X or Twitter. And so people can follow along to learn a little bit more. And then for those that are learning about those statistics, we're encouraging women to check out our dedicated campaign page for We Count, where we will have more information and tools and downloads for them and tips for speaking up and talking to their doctor.
I love that. That's really great that we're going to hit them in a lot of different ways and really give everybody lots of different opportunities to learn more and to share more and help spread the word. So, Sarah, if I'm listening to this podcast, I'm already familiar with the National Association for Continence, so there's a pretty good chance I'll see some of these materials out there. But if I want to learn more right now, what do I do?
You can visit our website, nafc.org. We have a plethora of information on our website about all the different types of incontinence. There's not just one, there are many. And then all of the different treatment options that exist for those. So it's a really great place to get education about the condition. And if you go specifically to our campaign page, which is nafc.org/we-count, you can download a doctor discussion guide that can help you have that important discussion with your doctor.
And how much does that cost?
It's free. Everything is free.
Yes, that's great. I always like to make sure that we emphasize everything is free. So yes, definitely take advantage of it now. So that brings me to my next question, which is one that you're very, very familiar with because you know that at the end of every podcast, we like to ask our guests if they have one hint or tip or bit of advice for people to live a life without leaks. So, Sarah, today I'm asking you, what is your bit of advice?
I think my best advice would be to not wait. Don't put off treatment because you think it's not a big deal or you think it's normal or you think it's going to go away. It often won't, and in most cases, it can get worse. So the longer you wait to seek treatment, the worse your condition can get, and you're spending all of this time living with a condition that you don't necessarily have to live with. Women who speak up do find that they have more treatment options and often have better outcomes than those who wait until problems are too severe to ignore. The sooner you seek treatment, the sooner you can find relief from the leaks and get back to living your life on your own terms.
Yeah, I think that's sage advice indeed. So with that being said, Sarah, I want to thank you very much for all of your insight. And Holly, I want to thank you for everything that you're doing to help get the word out and educate women about why it's important that they act now. So thank you both for joining us today.
Thank you, Bruce.
Life Without Leaks has been brought to you by the National Association for Continence. Our music is Rainbows by Kevin MacLeod. More information about NAFC is available online at nafc.org.